a consultation which is going on in Northern Ireland at the moment. This is entitled Public Policy Proposals to Inform the Development of a New Public Health Bill for Northern Ireland. The consultation opened on the 5th of July this year and it closes on the 27th of September. Let's have a look at the text from the actual consultation document itself. Now, this is the second consultation on public health legislation. The first happened in 2015 before the so-called pandemic. They are taking lessons learned from the pandemic to inform this consultation, and it says domestic regulations may be made for the purposes of preventing, protecting against, controlling or providing a public health response to the incidence or spread of infection or contamination in Northern Ireland, whether from risks originating there or elsewhere. It says the regulations may impose restrictions or requirements on or in relation to persons, things or premises in the event of or in response to a threat to public health, and in relation to a person. So we'll just look at what they say about persons. The regulations may impose a special restriction or requirement, such as requiring a person to submit to a medical examination, be detained in a hospital or other suitable establishment, keep a person in isolation or quarantine, require a person to be vaccinated or to receive other prophylactic treatment, a person to be disinfected or decontaminated, that the person provide information or answer questions about the person's health or other circumstances, the person's health be monitored and the results reported, that the person attend training or advice sessions on how to reduce the risk of infecting or contaminating others, that the person be subject to restrictions as to where the person may go or with whom the person has contact, that the person abstain from working or trading. That is just one aspect of this particular document. They say that the overarching principle of the draft bill is to protect the population against various forms of infection and contamination, including biological, chemical and radiological, in addition to infectious diseases. What this seems to be doing is putting this in place at a time when there is no public health emergency, and therefore this is not emergency legislation. It enables emergency restrictions without having to put through any kind of emergency legislation at the time. We would urge people to get involved in that consultation.